Welcome to our presentation on Friedreich's ataxia. So Friedreich ataxia is named after Professor Nicholas Friedreich of medicine, who was the first person to describe the condition in the 19th century. Although it is a rare disorder, it is the most common of all hereditary ataxias, with an estimated prevalence of 3 to 4 cases per 100,000 individuals, and it seems to be restricted to individuals from Europe, the Middle East, North Africa, and India. The symptoms for this disorder can appear any time between the age of 5 to 20, although there have been cases of late onset up to the age of 50. And it is characterized by a combination of loss of coordination, muscle weakness in the arms and legs, visual impairment, hearing impairment, slurred speech, cardiomyopathy, diabetes, sclerosis, and foot deformities. So Friedreich ataxia is a neurodegenerative disorder that occurs when the FXN gene contains amplified GAA repeats. So if you can see in this graph here, let me just move that. The normal state, the GAA repeat is between 7 to 22. However, for those who have Friedreich ataxia, the repeat of the GAA is over 60 and can go up to 1,000 repeats. What happens is that limits the production of a particular protein in the FXN gene called frataxin. One of the jobs of frataxin is to cleanse the cell of iron buildup. And with a frataxin deficiency, there is an iron buildup in the cells, leading to cell damage and ultimately cell death. And the main sites of pathology of the Friedreich ataxia is the dorsal root ganglia, the posterior columns of the spinal cord, the cortical spinal tracts, as well as the heart. And upon the first visit to the clinic, the patients with suspected Friedreich ataxia will be met with a plethora of physical examinations, and these is to gauge in the following: a lack of coordination because of the peripheral sensory neuropathy and spinal degeneration, and also they will be tested for the loss of deep tendon reflexes due to the deterioration of the dorsal root ganglia and their peripheral neuropathy. There will be a presence of sensory input and feedback regarding the body movement and position, and that is virtually present in all patients. There will also be a presence of visual impairment and or hearing loss, as well as uncleared articulation of speech due to the involvement of cranial nerves, the cerebellum, and the brainstem in Friedreich ataxia. In terms of the progression of the disorder, patients will need a wheelchair for mobility approximately 10 to 15 years after the disorder onset, and that is due to the advanced deterioration of the parietal tracts, which result in worsening of the muscle movement, coordination, as well as balance. But muscle strength is actually quite well preserved. In addition, hearing loss and visual impairment can worsen over time as well, and this may lead to a possible blindness and or deafness, reflecting the defects of the central auditory pathways. If you look at this graph, a normal reflex is a toes down. This is in a normal state, and those who have Friedreich ataxia, in terms of progression of the disorder, will show a fanning of the toes instead. I think heart dysfunction is actually one of the main causes of death for this particular disorder. Two common scales are used to assess as well as monitor the progression of the disorder. The first is the International Cooperative Ataxia Scale, and that's to assess 4 sections such as posture, connected function, speech, and oculomotor dysfunction. However, it's been said that this particular scale is not sensitive to the progression of the long-term progression of the disease. And so the Friedreich ataxia rating scale should be used instead. It is more sensitive to progression. However, the examination lasts approximately 10 minutes longer than the RCARS. And the Frederick Ataxia Rating Scale assesses disease stage, activities of daily living, upper limb and lower limb coordination, peripheral nerve functions, balance, oral motor control, and gait speed. In terms of neuropsychological testing, there's no neuropsychological testing currently used as a diagnostic tool. However, studies have shown abnormalities in a range of cognitive functions such as information processing, verbal fluency, visual spatial capacity, motor and mental reaction time, as well as working memory. And now it has been contributed to a disruption of the cerebellar prefrontal connectivity as well as the parietal temporal dysfunction. But it is important to keep in mind that these particular dysfunctions do not interfere significantly with the patient's education or social life. However, severe depression does occur in almost 10% of Friedreich ataxia's patients. And in terms of neuroimaging, MRIs are predominantly used to exclude other causes post-neurological examination. So other causes such as brain tumor or inflammation that is more characteristic of MS patients. But using a fMRI imaging, you can see a spinal atrophy, and in severe and advanced cases of Friedreich ataxia, it may show cerebellar atrophy. In addition, recent studies also shown a reduction in cortical thickness as well as a volume loss in extraparietal volume. And further testing is needed for a more concrete diagnostic. So that's why they use genetic testing, which directly detects the GAA expansion on the FXN gene. And to find an expansion of more than 60 in both copies of the FXN gene confirmed the diagnostic of Friedreich ataxia. So as you can see here, Friedreich ataxia share quite a few clinical symptoms with other recessive ataxias. So the age of onset can be similar to ataxia with vitamin E deficiency, as well as the presence of sensory axon loss. So in terms of diagnostic, it's more of a checking the red flags of what isn't there. So for example, red flags that makes a possibility that Friedreich ataxia is unlikely will be cerebellar atrophy, mental retardation, as well as preserved sensory action potentials. And given the overlap of these particular symptoms, genetic testing is used as a conclusive diagnostic tool for Friedreich ataxia. So that ends my presentation. Thank you very much for listening. Enjoy the rest of your day.